Went on in those structures.
All right, so that's structured, I guess we'll, call this meeting to order. Attendance, please.
Ann? Here. Don?
Here.
Grant?
Here.
Jim?
Here.
Mike?
Here.
Rod?
Present.
Toby?
Here. Right. All right, join us in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. May I have a motion for approval of this afternoon's agenda? I make a motion.
Second.
Second by Ann. All in favor, signify by saying aye. Aye. Motion is approved. Citizen comment. We had no one online. Is that right, you know? Okay. We have anyone here that would like to address this board? Seeing none, we'll move on. I need a motion for approval or disapproval of the minutes from last meeting. Approved, I'm sure. Motion approved. Okay, second. Motion's been made and second to accept the minutes from the March 21st meeting. Next item is an action item. And it's amending bylaws of the Flathead County Animal Advisory Committee. This is something we looked at last month.
Yeah.
And now it's being brought forward for action to us.
Cliff wasn't able to make it and he sends his apologies. So we have the original bylaws with the edits, or where he was editing, and then the final draft, Cliff and the board, they went back, the advisory board went back and made the changes that were requested to kind of encompass everything that they do down at the shelter. So it was hopeful that this one would go through.
And we had a pretty good discussion last month about this. Anyone have any additional issues with it this time? I guess what we can do then is we can ask for a motion to forward this to the commissioners.
Do we need to remove it from the table first?
I'm wondering whether we withdrew all of our motions and seconded, whether we need to pull it off the table. I was unsure about that. What do you know, Rob? Help me out here.
I don't know, but I think we would go along by taking it off the table so we can.
Let's do that first. Okay.
Well, I move to remove this from the table.
Okay, all in favor of removing this item from the table, signify by saying aye.
Aye.
Now we can move forward with the motion to forward it to the commissioners.
I move that we forward this as presented to the commissioners.
Well, second. Motion's made, second by Grant. All in favor, signify by saying aye.
Aye.
Motion is approved. Yeah, I was questioning that. So.
Yeah, I think it was tabled, so.
It was, but then we had withdrew all the motions and the second, so I wasn't sure how to go about
We tabled the last.
Yeah, we're good. All right, moving on, departmental reports. We'll start with community health.
Good afternoon, board members. My name is Tanner Dempsey with Community Health. I'm going to be presenting on the immunization clinic as well as home visiting in WIC. Indegress is out today, so I will start with immunizations. Our March numbers are, as we would expect, similar to last year. Not a lot going on this month. We did start a new person at the front desk. We filled that position and she started, Haley Tinlick, on April 8th. She's been catching on real quick and learning all the ropes. This week, myself and 3 other people attended the annual immunization workshop hosted by the University of Montana. And it was a great workshop, learned a lot. People like me who don't know a lot about immunizations had a lot to learn. I saw a lot of good information and everyone reported they got a lot out of it. So that was a successful event. Any questions on immunization stuff? Okay. Moving on to WIC, we had 1,039 participants in March, pretty similar to what we've seen before, not too out of the ordinary. We did have everyone in that department attended a conference or a training in March, so that they were able to keep the visitation up and keep the doors open as much as possible, which was great. We are currently working with the IT department to get all the computers set up for the new software that we're gonna be using. That's promises to be a lot more user friendly. We got reports from the pilot sites that they're really liking it and it's helping them a lot in their locations. We got almost all those done. Tina Reck has been great helping us out with that. And we just have a couple more laptops set up. I think we're all good to go. Everybody's set up for their trainings. Now it's gonna roll out May 21st. Everyone's very much looking forward to that. Any questions on WIC? Okay. On visiting, we got 2 programs. So I'll start with parents as teachers. Right now our caseloads are at 92%, which is great, within the range we like to see. In the last month, we've had 11 referrals from 6 agencies, 1 enrolled. Because we're in a transition right now with Karen Weaver leaving as the PAT lead. We may see a little bit of a wait list there, but I think it'll be temporary as we just onboard the next person. Once Karen leaves, we won't be replacing that with another lead. We'll just be doing a 0.8 FTE position. And then we kind of broke out some of the administrative duties that she's been doing amongst the team, and they're all very competent in those roles, and they feel really comfortable and good about that. It's a good career development thing for them as well, so they're all looking forward to that. And then last month, we had 4 outreach events, including a group connection with the annual Blue Ribbon event. They said there was a great turnout, approximately 10 to 12 families they know have attended, maybe more, but that's a pretty good turnout for that program. So we were happy to see that. And then for our Montana asthma program, we were at 67%, which was like last month. I know last month there was a question about why that number dipped. It was due to cleaning up the caseload, exiting people that weren't engaging, et cetera. So there's been a lot more effort. Jill Bull's been working a lot on increasing referrals. So one thing she did was she set up a self-referral option where people can use the QR code on the flyer and just submit their information, and she can reach out to those people. She's been working real hard also at engaging people in remote locations like Missoula and Browning and using Zoom. And it's been a little challenging working out some stuff there, but she's been, doing a lot of work there, and I would expect to see those efforts in the next, evident in our numbers in the next month or 2. Okay. Any questions on any of that?
Seeing none, thank you.
All right, thank you.
Next is population health.
Good afternoon. I don't have too much to report out today. Influenza and other respiratory illnesses, as you'll see, kind of trends down, which is kind of nice. And then some of the outliers on the communicable disease report, we did have a couple lead cases. One case was in a kiddo, a pediatric case, where the initial capillary test was a little above reportable level, and then the subsequent venous test was below reportable level, but investigation was still performed on that, and there was some potential occupational health hobby-related exposures, and of course, education was done with the family there. And then the other lead case was in an adult, and that was occupational related, and it was part of the routine test that they do with some of the staff at the exposure site. And then we did have a chickenpox, a varicella case last month. It was a pediatric case, and the individual was exposed to a relative that had shingles, came into direct contact with that shingles rash. So that's how they ended up with chickenpox. And there was some school-related exposures by that case, and by the Montana code indicated, we did have to exclude some of the exposed individuals in that school that were unvaccinated or under-vaccinated. So we worked very, very closely with the school to implement that intervention and exclude those kids. And then they had to be excluded for 21 days since last exposure. And fortunately, we did not have any reported cases after that initial one, so intervention worked well. The last thing when it comes to communicable disease, we did have an internal measles tabletop exercise last week, just with our population health staff, with our immunization staff, as well as our health officer. And the exercise scenario essentially was a pediatric individual who traveled abroad and came back and went to school while infectious and then sought care. So we went through that exercise from what we would do from start to finish with that investigation. And we came out of that exercise with some great things we need to do, some to-do list items, and that included, developing documentations, communication tools, making sure that we have open lines of communications with our partners locally and at the state level. So we will be working on that to make sure that if we do have if and when we have a case, then we can respond efficiently. And then the last thing, on the other side of population health, more on the chronic disease side, our Montana Cancer Screening Program will be working with the Logan Health Italy Mammal Bus. They'll be up in the Hungry Horse area on Thursday, May 9th. So if you know of anybody that lives up in the area and needs a mammogram, please feel free to give them the Montana Cancer Screening Program phone number and encourage them to get scheduled for a mammogram that day. Is there any questions?
Questions to the board?
Yeah, actually, can you put up that, perhaps that's the influenza vaccination rate, of influenza rate hospitalizations, data? Yeah, that one there. And the last time there was a suggestion that by looking at that lower graph there, that there's a great effect of the vaccination in preventing people from being hospitalized. But they actually analyzed that. That's not true, even though it appears to be. And the reason for that is that what's missing from that graph is the percentage of people who've been vaccinated. And we don't know specifically in the valley, but nationwide, it's about 1 in 4 adults. You had about 100 people in the hospital this last flu season. 25 were vaccinated, 75 weren't. But that's exactly the percentage of vaccination rate in the valley. So of the 25,000, let's say there's 100,000 people in the valley, adults. 25,000 of them were vaccinated, 75,000 weren't. 25 of the 25,000 that were vaccinated were in the hospital, 75 of the 75,000 that weren't were in there. That's about 1 in 1,000 for each. So really, there's no difference in the vaccination preventing hospitalization, even though it appears to be on that graph. Does that make sense? Okay. If the vaccination rate had been 50%, then that would show a very significant trend for vaccination preventing hospitalization. So it's kind of a flawed way to present data when you don't know the actual percentage of people that have been vaccinated. Does that make sense?
Yeah, I understand what you want.
Sometimes medical statistics can be presented in a way that doesn't tell you the true story. So, and that goes along with the fact that I think that this year the vaccination wasn't found to be very strain specific. I don't think it was extremely effective. That could vary from year to year. So, okay.
Keith, any further comments or questions? Seeing none, thank you. Family planning.
Good afternoon, board. Mandy Fleming with Family Planning. We did see a dip in patients for March, and March is typically a busier month for us. We did have a provider out a little bit for spring break, but definitely putting our heads together for some strategies on outreach and advertising to ensure that our patient numbers don't continue to trend like they did last month. April marks our new grant year for family planning, and so at the end of our year, we wanted to ensure that we met our goal of unduplicated patients because it does tie to grant funding, and we made it by the skin of our teeth. We were over by 16 patients, so we met our goal, which means we get fully funded for last grant cycle. We did some education and family planning, reaching a little over 300 people. Narcan distribution stayed about the same. Rachel, who works in our harm reduction program, was asked to speak at our Montana Public Health Conference at the beginning of April. So she talked about our efforts distributing Narcan and doing opioid overdose prevention, and it was pretty well attended, and she did a great job representing our program. As far as syringe exchange collection and distribution, I just wanted to highlight that right now we're sitting at about a 94% return rate, which is very high for a syringe exchange program. We're the highest in Montana by far, and that's above the national average as well. So Rachel's doing a really good job getting syringes back in and disposed of properly. Any questions? Sorry.
Yeah, the harm reduction program visits, you break it down into, continuous new.
Yes,
Does that continuous, how do you determine continuous from when? The last month or over the year or
ever.
ever?
Yes, ever enrolled in our program.
So there's quite a bit of ongoing continual involvement.
Yes.
Any further questions?
Thank you.
Seeing none, thank you. All right, next, environmental health.
Good afternoon, I'm Jim Wardensky with Environmental Health, and I don't have a ton of things to talk about today. You know, as you can see, based on the numbers in the worksheet there, things are trending upward, and we kind of anticipate that given the time of the year. Building increases and, you know, community involvement on the food side of things goes up, and we see plan reviews increasing and things of that nature, so. I did include some stat sheets for the burn permit stuff, just to give an idea of what it looked like last year in 2023. I think we're about 5,200 plus burn permits since we started that online burn permit process. To give an example, the year before, although it was somewhat of an estimate because DNRC's system broke and we had to track some of it manually, but we're in the 3,300 permits for 2022, so pretty substantial increase. And then I included the up till the beginning of April of this year, and so you can see the numbers there as well. So that system seems to be working very well. You know, on occasion, we'll get folks coming into the office and asking for assistance. We're happy to do that, so to get it all taken care of, and or over the phone, they'll call. And the one thing that I was surprised about is I would have guessed that there would have been far more phone activations for the burn permits, but it seems that a fair amount of people are doing it online, which is good from a cost standpoint, you know. So happy to see that, so. One other thing, I guess, that I wanted to mention, and this is kind of symptomatic of our division, is that in the short time that I've been there, as I interact with counterparts across the state, one of the things that I've learned is that Flathead County Environmental Health is kind of a pioneer in a lot of aspects. So an example that I would offer is in continual evaluation of our processes and practices and budget and all that stuff. One of the things that I wanted to implement is we receive all of the licensing for food and consumer, public accommodations, you know, all of those licenses. on the food side of, our division. And as we are tasked with processing those, there's, I don't know, a hair over 3,000 licenses that we have to process every year. And the way that works is the state sends us the physical license, then we have to scan it into our system, and then we take the physical license, fold it, put it in an envelope and mail it out, and Flathead County has to pay the postage on it. So when I reached out to the state, I said, we're paying thousands of dollars in postage for your license. How about giving us prepaid envelopes? And they said, oh, well, we're not gonna do that. That's very costly. And I said, exactly. That's right. And so the idea that was hatched is, why can't we just email these licenses to the people that are receiving them? And we had to make sure statutorily that we were allowed to do that. So I reached out to DPHHS and they said, we don't see any reason why you couldn't. One of the things that I've asked the sanitarians is, as they're going out and doing those inspections, to collect good contact information, which is part of emergency preparedness anyway, so, there's a twofold reason to do it. DPHHS said, hey, you guys are the first ones in the state to do this, let us know how it turns out. This coming year, when the licenses renew, that's what we're gonna attempt to do. I suspect that there's gonna be a cost savings, between labor and postage and all that stuff, somewhere between $3,000 and $5,000. So, just one little process change that, is gonna make things easier, I think, for everybody, so. And then the last thing that I would bring up is, and I think I mentioned this previously, but early in the beginning of April, the public health confluence occurred down in Missoula, and environmental health had 3 recipients of awards. Here you can see Jesse Green. Jesse's one of our sanitarians on the food side of the house. Here is Shelley Stout, she's a front office person. And then lastly, Wendy Jacobs, and she's the sanitarian on the land side of the house. So those are statewide awards, so pretty proud of that, and good job that our folks are doing. So I don't have anything else unless you have questions.
I have one. Jim, sir, thanks and good job with the postage savings. Those little things make huge differences, so I'm glad that you were looking at that.
Yeah.
Second question I have is, we've talked about this before with the tourist homes under consumer plan reviews.
Yes.
So we still don't have any way of knowing, these are the ones that come to you, right? But we still don't have any way of knowing if anyone's flying under the radar.
Right.
Is there any talk about, I know that there's some software programs out there and City of Kalispell's investigated those. But we don't have a compliance officer either, do we?
No.
So there's nothing we can do for any of the non-compliant.
Well, there is, and if we receive complaints on them, then we investigate them. Just from a staffing standpoint, and it'll be interesting because I think Whitefish has adopted that practice that they hired somebody specifically for that. So we'll see how that turns out, and how much work that they generate as a result of it. I think that there's been a decline in the amount of tourist homes and all that stuff. However, every year you never know. Maybe it's a decline because they're not applying as much. We're seeing less plan reviews come to our office. But definitely if there's a complaint, we receive complaints weekly about that stuff. That's one thing that, we have one technician that deals with all of the septic and air quality complaints, and then the rest of us kind of pitch in. And food complaints that's shared by the 4 sanitarians that do that portion of it, so. Yeah,
Thank you.
yeah,
Rod, is it, like VRBOs that you're talking about, or
Yes.
people that buy a home that just want it to be a place?
Correct. And they have to be inspected. I know with the city, there's, fire has to go in and make inspections and, I mean, it's a safety issue. This is just the thing. It's like, we don't have a problem with people doing whatever they want with personal property, but it still has to be done properly and in order and make sure that they're paying the state their fair share of the bed tax.
Yeah.
There's that too.
yeah, and from a septic standpoint, I mean, we just had one, this week, or at Lake Plain, they submitted public accommodations. And when we looked at it, the septic permit was for a 2-bedroom house, and they have, 4-bedroom house, they converted the garage into 2 apartments, and they have an additional living unit there. So really, it equates to about 8 bedrooms on a septic that was permitted in 1975 and has a dry well. So of course, we're communicating with them and trying to bring them into compliance on that type of stuff.
So Jim, one of the other things that the health department is involved with the VRBOs or whatever is doing a health inspection, initial health inspection, isn't it? It's not only fire for safety, but it's also the initial health inspection.
Yes.
Or, can you explain that?
Yeah, so, similar to any public accommodations, inspection, they go in and some of the things they seem like fairly trivial, but when you think about it, not so much. To make sure that there are non-slip surfaces in the bathtub or shower, to make sure that the water temperature that's coming out of the water heater isn't scalding hot, so somebody, a little kid turns it on and burns themselves. Things that the average person probably wouldn't think about, but if you have an ice cube maker or ice cube trays in your freezer, that each time a client cycles out, those have to be dumped out, because you don't know if somebody took a glass and scooped it out of there and their hands were dirty and contaminated the ice. If you offer silverware and, cups and glasses and all that stuff, that all has to be sanitized between each use. So that way somebody doesn't dip the spoon in the peanut butter and lick it off and stick it back in the drawer. It's just stuff that, so a whole host of things, they look at laundry, and how that's set up. So that way there's a hand washing sink in close proximity to, the laundry facility, so they don't take soiled clothes, put them in the wash machine and they go to the dryer with dirty hands after they handled soiled clothes and take the clean clothes out and fold them up. A lot of different things that, again, from a sanitation standpoint, so.
The part of that so bothers me is the fact that we do that initially.
Yeah,
And after that,
Yeah.
we're not back there, you can only hope that we're leaving them with the information they're gonna follow, because as a consumer, when you go to a VRBO, you say, oh, well, it's been licensed, which
right,
is great, instead of the unlicensed ones,
Yeah.
but are all these things being followed? So I don't know the answer to that, I just know that's always been kind of a bone of contention.
yeah, no, I agree.
What's the estimated people per bedroom that define the septic rules?
2,
Two.
yeah,
I was thinking about the same concept over spring break, as we had 9 people sharing a house, 2-bedroom house that had sleeping rooms for 12 on a septic system down in the Target area.
Yeah.
And so I did a quick look of just our county areas where I know people are on septic, and some of the houses were 2 people per bedroom, some of them were up to 4 people per bedroom. It's what they allow for their Airbnb rentals, so.
and to a certain extent, we try and account for that, and so they average it out, the use, so there may be peak times where you have company or, special events or whatever, and then there may be times where, the average household, 2 people live there and they're both at work during the day, so there's no usage and, so they factor all that stuff into it.
think another thing is that it's much easier to police that in, city areas where you have zoning. You know, because it's a zoning issue. When we get out in the county, so much of it's unzoned, it's much harder to police. The only policing we have pretty much is our sanitation department.
Right. Yeah.
Is comment. Anybody have anything else for Jim?
Thank you.
None, thank you. Mosquito.
Good afternoon. I don't think I got any mud on me today from doing inspections, so we'll see. So the last month, the mosquito control program has been very busy. To be expected in the spring. We've had 815 inspections, 184 treatments, sites treated were 173. Acres treated was just under 500 acres. And new sites added was 6 in the last month. So we've been very busy. We've noticed that countywide, the surface water levels are actually below normal for this time of year, which is, I guess, the only good thing is for our program. It's helping us out, keeping up with our 14-day routine inspections. So, so far, I guess for the 2024 mosquito season, the average is kind of average for the floodwater mosquitoes, so the 80s mosquitoes. And then we're predicting above average for the Culex West Nile mosquito. The reason that is because on dry years, dry hot years, birds congregate more. They carry West Nile, and so you typically will see those West Nile cases spike on hot, dry seasons, so. Lastly, Washington Days is in May, that's a big event. Dave Nixon, he is gonna be going to that, it's a conference and a way to meet legislators in DC. So it's a huge thing, it's really big for Montana to have somebody go and be a representative. The other individual going is a MSU professor, Robert Peterson. He's gonna be speaking at the conference. So we'll have 2 people there, which is great. So while Dave is there, he's gonna be doing the conference for 1 day, and then a lot of it is educating the legislators on vector control and the importance of it in Montana, how it affects our districts, how their choices affect their districts and people's livelihoods throughout Montana. And then, yeah, it's a 1-day conference, so he'll be getting some CEUs for going for that too, so. And that's it. Thank you. Any questions?
All good. Thank you, Michaelis. Next up is finance.
Good afternoon, Kurt Zander, accountant for the health department. A couple things for today. One, we're going finance report from March to March 31st. Pretty status quo. Ended up with about $1 million in cash at the end of the month. Right where we want to be. Of course, we'll get an injection tax receipts coming here in May that will carry us through the rest of the year. Number 2 is that the finance committee, we sat down on April 8th and went through the budget. We discussed revenues, expenses, cash flows, and the capital improvement expenses for all the different funds of the health department. We had a total budget of $8.7 million, which covers the health department general fund of about $3.9 million. And then the health department grants, which is about $3.7 million. And then the remainder was the mosquito fund, animal shelter, and donations and trust accounts and so on. So, but some of the items that factored into the budget discussion, grants are still in the early stages of determining funding. So we may have some grants that are changing funding streams, dollar amounts coming down the road. The payroll estimate, the COLA for this coming year from the finance department, 4.1% was factored into the budget. So an increase. The animal shelter donation account balance, we're keeping an eye on because over time that relies on donations from individuals, and if the economy is slowing up, it's very possible that those donations won't keep pace with some of the expenses, so we'll keep an eye on that to make sure that we sort of temper those expenses, but eventually, if that runs down to zero, those expenses will go on to the county's general health fund, so. We had environmental health revenues projected to be down a little bit, about 6% or so, due to higher interest rates. We lost a half-time FTE on the custodial position, which was reduced due to workload, so that was a good thing. That helped a little bit of savings on our end. And we had some IT support savings. They centralized some of the costs for some of our IT support, so that helped us out. One of the things that are working against this, we have lease revenue for Greater Valley Healthcare. They're looking to be out possibly in the following spring. In the budget, it's built in that they'll, those revenues will come through December or so, and if we get a little bit more than that, that's great, but they will be vacating at some point, which is, we're gonna miss that revenue, so. And then through that whole process, after going through the calculations and so on, we're looking at a mill levy at about 4.61 mills, which is sort of near the top of what we can mill this year. So, and we want to end up with a cash balance of about 1.2 million by the end of next fiscal year. So, and so that's actually where we want to end up about this year too. So we've got through this process. We'll meet tomorrow with the Flathead County Administrative Review people, the finance department and county administrator, and we'll go through different line items on the budget, just to follow up with our discussion after the finance subcommittee, and then a commissioner review on May 13th. And so, any questions on the attached monthly report or preliminary budget, including the there is a sidebar process for an additional FTE for the animal shelter, so that'll come into effect.
Rob, thanks. Kirk, I do have one question on the capital improvement, page 3, where we had budgeted $2,000 on interest earnings and we got just short of 26,000.
We're at on
Page 3, under revenue interest earnings.
Are you on the monthly report?
Yes, on the monthly report, I'm sorry.
Yes, that's correct. Which is a good thing.
Was that I mean, that's astounding.
That's how fast rates have come up over this last year. Yeah, so when we budgeted, that would have been almost like a year previous. That's how fast rates have come up from, so they're averaging probably around 5%, maybe a little less than that on some of their balances at the county. So yeah, we've been a beneficiary of that, so.
It's a nice benefit.
Yes, yes.
Yeah, it was such a stark contrast to come on.
Our inflation's always working against us too, so.
Yeah, I know. Yeah, coal was not even close.
Yeah, yeah. So,
Okay, thank you.
yes.
One further, any questions? Seeing none, thank you. Health officers, well, Dave.
Everybody took my stuff that I had written down, but I'll just say it again. We have the budget review tomorrow for, with Pete Melnick and Amy Dexter, and we'll go through it. And they go through it pretty line by line, throughout that. And then if there's any things that need to be changed, we'll obviously let the finance committee know that, you know, if any changes that they may come up with. So the co-responder program, I'm reluctant to say it. I'm knocking on Formica and everything else I can. We think that we have somebody that we're gonna hire. We're gonna be asking for a contract with this individual, and if it all works out, they would start in June is our hope. So that would give us 2 co-responders. So that would certainly help, with that. And then obviously we would, continue to look for the third co-responder, because that's ideally what law enforcement would like, would be able to have a team of 3 co-responders. Again, it's such a specialized area. The funding for it is starting to get more solidified, so to speak. The grants are coming in, and then also, the money that we would be able to get for Medicaid reimbursement is, coming through, meaning that the state has finally finalized what they're gonna be able to get compensated for when they do it. There was a lot of discussion beforehand. We live in such a big county that the drive time and those types of things weren't taken into consideration, so it was truly just face to face. Well, sometimes it may take Sarah 45 minutes to get to someplace, and then 45 minutes to get them back to the hospital or wherever she may have to take them, and so they were working on a lot of those kinks, and I think they finally got it taken care of at the state. So that's looking upwards for that program. We're super excited about all of those things. Janelle has been working extremely hard to get everything working with the co-responder, trying to line everything up that they could start in June is the hope. So any questions on that? I want to give a shout out to Lisa's crew with the syphilis investigation that they have been doing. It's been pretty complicated, and it has been very convoluted, and they've done a phenomenal job finding the individuals that we may have been lost to contact to truly try to get a handle on the syphilis, because it has definitely increased this last couple months, and they have done a phenomenal job. All of them have following up with that and doing that. So just a kudos to them for that. I did have the awards on here. So Shelley Stout got the exemplary award. Keelani had the excellence award for under 5 years. Good job, Keelani. Wendy Jacobs got the 25-year plus career achievement award, and Jesse got the distinguished service award. So that was given to them by the Montana Public Health Association. Jim did a great job nominating individuals, and there was a bunch of letters written by people to honor all of these individuals that are doing such astounding work here at the health department. So we really do appreciate everything that they are doing and being recognized for it. So that's all I have.
All right. Anyone have any questions for our director?
Well, I do want to say with the VRBOs, since that was brought up, I do believe I was on a large health department call, and I do believe that we have the most VRBOs registered in the state of Montana. So isn't it is it 1,300, Jim? Somewhere around there. And when I made mention that to the other health departments around the state, they were astounded by how many we had. I would say we're hundreds and hundreds above anybody else in the state on those. So they are doing an excellent job. I still think that there's probably 1,000 out there that we don't know. But by state standards, we are far above anybody else for getting those registered at least.
That's including cities.
Yeah, it's counties, because they, even the cities have to go through the counties, so.
Okay. If nothing further, but again, we'll move on to a committee report, the finance committee. Is there anything further to report on?
I'll do a wrap up on that. It's every year we go through finance. And Kirk, you do such an amazing job even monthly to keep us, updated and sorting out all the details. And when we sit down to do it annually, it makes it so much easier to go through all of that, just because of the work you do consistently for this board. But I will say, every time I sit through one of these budget meetings, I learn something new about the department, about how the interactions work and that sort of thing. So if anyone else wants to jump in on those meetings, it's always beneficial. But again, Kirk, thanks for the good work on that. Thank you.
And I'll jump in on that. Kirk does such an excellent job on the accounting side and the reporting, and for giving the reports out. They're easy to read, they're thorough. And with a finance background, I can say I haven't seen anybody that has that capability. And I know it's a boring subject for most people, but it is kind of the heart of something happened. But no, just an absolutely great job. There's nothing I have to add. And I don't see anything ahead of us that would hurt us in the future. I mean, it'd have to be a black swan event, right? for us to get, but I think everything is on track, and I think we're in good shape. And Jim, I'll tell you what, that's the second time you've come in with a money saving or a great idea. That idea that you have is absolutely great, that, and I agree with you, it's those little things like that that make it, but it tells you that you're looking at it seriously, and that $3,000 to $5,000 savings is, and not including the frustration and the headache, you and your department have just done an excellent job on that, and the other departments as well, but obviously I'm picking on you because there's money involved, right? But no, just really excellent, we need to give you a raise, I think. I know we can, but. Wait, you earned it.
That all from the finance committee, report. Yeah.
Thank you.
Next is board member discussion. Who would like to start? But you have anything you'd like to bring up?
I just had one follow-up. I had asked, I think at the last meeting, what the expiration and shelf life were for Narcan that we were distributing out. And because you don't want to have ineffective Narcan out there in the community. And actually, when I looked it up, it looks like the FDA has extended the shelf life for Narcan to like 3 or 4 years. So when we do hand it out, it seems it'll be effective for a long period of time. The only downside of that is in 3 or 4 years, are people going to think to look at the expiration date when they're going to use it, but that's beside the point. So it does have a long shelf life, so you don't have to worry about that too much, so.
I get one question or request, I guess. We had several, in our environmental health committee, and in this group, we talked about several of the legal issues going on with septics and being approved, moving them on to the state and everything. I'd like to get a report back on where we're at on those issues, what our issues are at this point.
Well, it's still
Where they're
this,
going.
yeah, it's still the same issue and it's still in legal. So, we really can't talk about it because it's in legal. David Randall is handling it from here on out. He has asked for, I think Jim gave a briefing 2 meetings ago, a little bit about where we were, but, again, it's all of those same issues. The 48 inches to groundwater is still in DEQ's hands and we haven't got a ruling on it. So, you know, I'd like to give you an update, but we really don't have any. David's been asked a few questions, Jim has responded and his crew have responded with what David has asked, and then we've sent it back to the attorneys again, so. It's kind of no news because we don't have any news, but.
Can you answer this? Are there any legal actions being brought against the county because of those decisions?
Well, it's kind of, we are, I mean, it's not, we're not, no, because it's in DEQ's hands. So they haven't come back. I can't say that that won't happen,
Okay.
After whatever DEQ decides. The board will then be given some options from what DEQ decides, one way or the other, or the other way. There's a couple of ways that they could go with all of this. There's other ones that are out there that I think are waiting and seeing. So the ones that were brought to the environmental subcommittee, previously, we've done, one denial. They didn't proceed to go further to take it to DEQ because I think they want to see what's happening there. It's kind of the same with the incendiary toilets. That's in DEQ's hands as well. Jim has worked tirelessly with the individuals to try to figure some other things out for them or whatever it is, but I think the last message was it's now in DEQ's hands. We have done everything that we've exhausted everything that we can do here, and we are just waiting for DEQ to make a ruling.
Yeah, thank you for that info. Anything further? Rob?
Just one thing, Dr. Pahar, thank you so much for bringing up statistics. It reminds me of college. And and we always ask here, let's have more data. More data is always better than not enough. And if I learned anything from statistics, it was from politicians, which was there's lies, damn lies, and statistics. So more information is always greater. And I appreciate all the staff. Every time we ask for something, you give us what we ask for and give us more. So, but thanks for bringing that up. That's all.
Anyone else?
Well, speaking of statistics,
Good.
I started doing some literature review after our last meeting on PFASs and kind of looking back at some of the research studies that have found some of the negative influences, mostly looking at the human studies, which are not the mice studies, because
Yeah.
when they start going LD 50/50 and a little less to see how it might kill mice, I don't think necessarily always translates to the human population, but I did see the Kalispell recent test, they did not pass the new federal levels, and there's gonna be a county level discussion on June 10th, so. We've got a few papers that I tore apart and evaluate probably which statistics are lying. Or they manipulate their results to make the result look bigger. But nothing that I've summarized yet, but it is interesting. The one that's commonly referred to for kidney and testicular cancer. The other two large results were actually reductions in breast and lung cancer. And I'll talk about that. But I started looking at some of the thyroid-based ones as well, which they do a lot of data manipulations to find significance. But the one that was really interesting because they had this nice big table of all 200 comparisons they did of all these different PFASs and thyroid hormones. About 200 comparisons, they found 8 significant ones, which with 95% error rate, you would expect to find 5 false positives.
Okay.
So they're finding about what you would expect for no significance. So I don't know if the health board has any thoughts on if we make any recommendations to the county on that, or if there's any role for us in this whole discussion. I did spend a little bit of time looking at and working on putting together a review, so to speak.
Can you, give us more information on that meeting? You said June 10th?
I think it was June 10th. Yeah, I just saw a newspaper or an article on it like about 11:30 this morning.
Who's hosting the meeting? Did you see
It was
that?
a county one, yeah.
A county meeting?
I think it was similar to the last one. I still have it open. KPAX news report this afternoon. Or this morning. Says the city council will host a public workshop to discuss on June 10th.
Oh, City of Kalispell.
Yeah.
City. I don't know what the board's position would be on that.
I think there's so much in the air right now that, I mean, it's.
I think we should watch it for certain. I think it's great that we compile the data and are aware of what's going on. And again, statistics are important. You know, the fear thing is always what the news is gonna grasp onto, and that's what the community is hearing. You know, they're not hearing the other side of it. They're just hearing the fear mongering part. So even if we have at some point with enough data, just make up your own mind, but make it public. I don't know, let's watch it.
Anyone further? Thanks, Ryan. Seeing none, I have a motion. Adjourn.
Make a motion. I'll second.
Motion's been made and seconded to adjourn. All in favor?
All right.
Aye.